So I recently went to the doctor a couple weeks ago, and he wanted to run some blood work since I had some done when I was pregnant a few years ago, right? Iron, CBC. The last time I had a lipid panel, I don't even know. So he had me go in for some blood work. I had to come back, right? Because he wanted to do fasting glucose. So I had to fast and all that fun stuff. Side note, I have really good obvious veins. I don't know if you can see them on here, but yeah, it's really easy to draw blood from my arm. And I mean, it kind of hurts, but I really like watching it. It's the way they do it with the tubes. They just pop them in and then the blood shoots into it. It's awesome. The only time I had a problem was early 20s, I think. I had blood work done. And this lady used a finger prick, and it was like a bunch of stuff. By the end, she was scraping my finger to get enough blood. Oh my God. I was losing my mind. I can't believe I was so nice about it with her. Maybe I shouldn't have been. But anyway, got a bunch of blood work done and got the results back. Got all of them back, I think, that very day, which is cool. But also maybe not, because you know there are people getting the results back before their doctors have even seen them and then contacting the doctor. Like, I don't know, like maybe those shouldn't be released until your doctor has at least had a chance to look at them. Anyway, I am not a doctor. I should say that. This is just for fun. So we'll start with the CBC, the complete blood count. This is white cell count, red cell count, platelets, the size of your red blood cells. There's a lot of different stuff they check for here. This can help tell you or your doctor, you know, maybe you have anemia or leukemia, B12 deficiency. So for example, there's MCV, mean corpuscular volume. This measures the size of your red blood cells. If the size is smaller, that could indicate iron deficiency anemia. If the size is larger than average, that could indicate a B12 deficiency. It's not enough to diagnose you with iron deficiency anemia or B12 or something else. It's just kind of one of those initial markers. If your MCV does come back low, then ideally you would get like your iron checked, ferritin. On the flip side, if they're too large, you would want to check your serum B12. As you can see here, mine is right at the top, at least for this lab. This is a good example of differences between labs. If you look up the normal range for MCV, it pretty much always says 80 to 100. I don't know why this lab is a tiny bit lower. Everything else is normal, back to normal. Again, I did have CBC done when I was pregnant a few years ago with my final baby, who's almost 3 now. That's just crazy. Things were a little bit off. Red blood cell count, I think, was a little low, and a couple of other things. That's pretty typical during pregnancy. Not enough to do anything about it. My doctor wasn't concerned, but yeah, looks like everything's back to normal. There used to be this kind of myth that white blood cell, WBC, the first one there, that for vegans, it's common and even like healthy for this to be lower because it means your body doesn't have as much bad stuff to fight off because you're so healthy. There's no evidence for that. I don't think any doctor would say, oh, your white blood cell count is 2. Oh, but you're vegan. Oh, it's fine then. I haven't heard that myth in like a long time. And I think that was mostly from like raw food vegans. But yeah, I don't even know if that's around anymore. I just remembered it from my raw food days. Now we get to a little bit more interesting stuff, the comprehensive metabolic panel. So this includes fasting glucose. It also includes a lot of stuff that's mostly checking for like liver damage, kidney damage, or potential, kidney liver problems. Start with fasting glucose. That is totally normal, which is not surprising. I've never had any issues with my glucose levels. Even when I ate a super high fruit diet, I actually bought a little glucose monitor and checked like after giant 64-ounce smoothies, and I was fine. There's no history of diabetes in my family, I don't think. So yeah, not too surprising there. I can't believe I forgot this, but I did actually fail. I didn't do super well on my gestational glucose test, where they make you drink this disgusting sweet kind of Sprite type thing. Oh, it's disgusting. And then you have to wait an hour and they check your glucose, and mine was elevated. So I had to go back in for a 3-hour glucose test where they take your glucose fasting. And again, I'm pregnant. Like, I'm pretty pregnant at this point. I think it was like 2nd trimester, early 3rd trimester, somewhere around there. And so I have to go in, no food, and get my glucose tested, drink the sugary shit again, wait an hour, get tested again, wait another hour, wait another hour, no food, pregnant. It was terrible. I felt so sick, so nauseous. I remember I was just sitting there watching Taskmaster, trying to keep my mind off the nausea. Anyway, everything was fine. And then, like I said, the rest of the stuff is mostly checking like kidney, liver function. We've got BUN, blood, urea, nitrogen. We also have, it's not creatinine, creatinine. I got it. That is just one of those. I've said it wrong for so long that I can't do it. Creatinine. Sodium, potassium, chloride, electrolytes there. This, again, can also indicate kidney function. Carbon dioxide, calcium. I'll save calcium for a little bit later. Protein, total protein, albumin, globulin, bilirubin. So we're getting to more of the liver stuff. ALK, AST, ALT. That's all kind of liver function markers. One of these was high with my second pregnancy. It was so close to my due date. In fact, I was going in Monday, and that Saturday, right before I was going to go to bed, and all of a sudden, palms of my hands and the bottoms of my feet got itchy, which is a sign of cholestasis, which is a very, very serious complication, pregnancy complication. And so I called the nurse, and she said, you got to go in. So went in the next morning, and they were like, well, the test we do for cholestasis won't come back for a week. And by then you'll be past your due date and everything anyway. So we just checked alkaline phosphatase, or maybe ALT, I think, and that was elevated. So they were like, so let's go ahead and induce. Like, okay, fine. And then my doctor came in Monday, and she was like, what happened? I didn't get to deliver. What happened? Anyway, my liver and kidneys seem to be fine, except we do have one more. We have microalbumin creatinine ratio. This is actually a urine test. I didn't know I was going to be doing leaving a urine sample. I would have probably had a lot more water if I knew that was happening. Anyway, high levels can indicate kidney disease. Mine, you can see here, is moderately increased. You want it under 30. Mine's 41. My doctor's not concerned about this, I would imagine, because all of my other, kidney function markers are normal. And again, I was dehydrated. It was 8 something in the morning. I was fasting for the glucose test. I hadn't even had coffee. Like, I think I had maybe half a cup of water or something like that. I have a follow-up scheduled with my doctor in 3 months. And yeah, I'll ask him if he wants me to do it again, and I will make sure I'm hydrated. Now we get to the fun. Maybe I should save the fun one for the end, but whatever. Lipid panel. This is what I was excited for, I guess. I don't know, anticipating, because I am getting a little bit older and it's so important. I didn't really know what to expect. I mean, yes, I'm vegan and I eat pretty healthy, but you never know. Yeah, I'm happy to say pretty damn good. Total cholesterol 129, triglycerides normal, VLDL cholesterol. This is a calculation using your triglyceride levels. Totally normal. LDL 61. I could not be happier with this. Now, HDL, I know if there are any like carnivore keto people watching, oh no, the HDL, that means I'm unhealthy, I'm at risk for heart disease. It's not that simple. Mine is 46, which could be fine. This lab says over 39 is normal, but many do say greater than 50 or even greater than 60 is ideal. Anything lower than 50 for men or women puts you at risk for cardiovascular disease or increases your risk for CVD. Some, again, like carnivore, paleo, keto people say the higher the better with HDL. That's not what the evidence says. There are people with genetic mutations that cause their HDL to be very high, like 100 plus. And so you would think, well, they have higher HDL. If HDL is so protective, they would be at lower risk for CVD. No, they're just as likely to have heart disease as people without HDL raising mutations. Also, 5 major clinical trials that sought to raise HDL levels with drugs have failed to lower heart disease risk. Another issue is that low HDL typically co-occurs with other problems like obesity, diabetes, hypertension, all 3 of which are risk factors for CVD. So maybe it's not the low HDL that's the problem, it's the obesity, the diabetes, hypertension. Finally, the reason HDL is beneficial is because it grabs bad cholesterol, LDL, out of the blood, ferries it to the liver to be filtered out of the body. But if you have low LDL, it's unclear how beneficial HDL really is, or having higher levels of HDL would really be. Assuming you don't have an actually low HDL, like below 40. For instance, this study, they looked at 5-year major cardiovascular event risk. So your risk of having some sort of major cardiovascular event within the next 5 years, and found an increased risk with below 40 HDL, even for people with really low LDL, below 70. What does all of this mean for people with low HDL? Think of it as a warning to pay attention to your other numbers, especially your LDL, which should still be your primary focus. Aim for an LDL of 100 or lower, ideally through lifestyle changes such as weight loss, a healthy diet, and exercise, plus cholesterol-lowering statins if indicated. Given the rest of my lipid panel, especially my really low LDL, and that I don't have diabetes, obesity, hypertension, I'm personally not at all concerned about my HDL, neither is my doctor, to be clear. And even if I wanted to raise my HDL above 50 or 60 or whatever, I'm not even sure how I would do that. I already eat so much healthy fat. I work out 5 to 6 days a week. I don't smoke. I guess I could start drinking. Alcohol can raise your HDL levels. Yeah, I'm not going to do that. A1c, this really goes along with fasting glucose. It's a way to check for hyperglycemia for type 2 diabetes. Mine is normal. Iron. We have several different tests here, several different markers. This one was also interesting given that I have been iron deficient so many times in the past, but it has been years since I have been, and throughout all of my pregnancies, my iron was fine. So not too surprising that my iron is still fine. My ferritin, iron binding capacity, UIBC, which is your unsaturated iron binding capacity. This is checking like your total iron carrying capacity, iron saturation, blah, blah, blah. Yeah, all normal. Finally, vitamin D. My vitamin D is 22.1 nanograms per milliliter. So it's not deficient. That's below 20. Between 20 and 30 is considered insufficient. Now, it's not clear if that's actually true. I talked about this a lot recently. I think it was in the Eric Berg video, Dr. quote unquote Eric Berg. He thinks we should all take like 10,000 international units of vitamin D a day. Insane. Actual professionals do not recommend that much, but most of them do recommend the, 20 to 30 is insufficient. You want to be above 30. In other words, most doctors would encourage me to raise my vitamin D. There would be presumably benefits for me to have vitamin D above 30 or above 29. Now, many experts are calling this into question, given the really mountain of evidence that's been done on vitamin D levels, higher vitamin D levels, and various health markers, and virtually all of them have found nothing. The only thing we really know for sure, they say, is that vitamin D is good for bone health, so the cutoff should be 20 nanograms per milliliter. If someone like me has 22, that's fine. Although many leading epidemiologists and endocrinologists who were actually involved in setting this 20 nanograms per milliliter cutoff say that, number one, it wasn't designed to be a cutoff. It wasn't meant to define deficiency. It was merely defined as an acceptable level of vitamin D. They feel we are over-screening for vitamin D deficiency and unnecessarily treating individuals who are perfectly fine. They say the cutoff should actually be 12.5, not 20. Again, I am not a doctor. I'm not at all saying ignore your doctor. If you have a 22 vitamin D score and your doctor's like supplement, don't ignore them because of a YouTuber. But I wouldn't be surprised if my 22.1 is fine. Actually, I was pretty surprised it wasn't lower, given this is the absolute end of winter. It was actually like a few days after the first day of spring that I had this blood work done. So naturally my vitamin D would be lower than it would be like at the end of summer. And also I didn't take my extra vitamin D that I normally take during the winter months. I didn't do that this past winter. So yeah, I was kind of pleasantly surprised about my 22.1. I will admit I am tempted not to supplement other than the vitamin D I get from my multi, which I also haven't been taking as consistently as I should. However, calcium. I said I would save calcium for later. yeah, my calcium is a little bit low. Now, again, labs have different values. Most labs have a cutoff of 8.5, not 8.7. But yeah, slightly low. And why I'm bringing this up when we're talking about vitamin D, well, low calcium can be a sign of vitamin D deficiency. So yes, I am going to follow my doctor's orders. He wants me to take 50,000 international units per week for the next few months. That's pretty standard. And yeah, at my follow-up in a few months, we'll test again. So that is it. And you may be wondering about B12, and I'm kind of kicking myself there. Well, so what happened? This is my first time seeing this doctor. He was great. And we were talking about the birth control I'm on. I take a contraceptive pill, and he was asking why I take it. And long story short, he was like, have you thought about an IUD? And it caught me off guard because really for the last year or so, I've been thinking about it. But then, I don't know, you hear all these horror stories and the pill works, it works as contraceptive, and it also helps with my awful, painful, irregular periods, makes them pretty normal. So I was like, I just won't worry about it. But the fact that he brought it up, I couldn't think about anything else. He was like, let's set you up with a consultation with our doctor who does IUD insertion. And I want you to get some blood work. And I was like, okay, fine, whatever. And then after the fact, I was like, shit, I should get B12 too. Just throw it in there. But yeah, I was too focused on IUD, and I did have my consultation, and the doctor was great. And yeah, I don't know, maybe I'll talk about all that stuff at a later point. At the follow-up, I will bring up B12 and see if he can order me that and I can get that checked. I'm just so happy with that LDL, 61. Come on. You guys know how much fat I eat. Yeah, it's mostly unsaturated fat, but it's a lot of fat, man. I have plenty of 100-gram days, 100 grams of fat, I try to limit coconut, although I haven't really been as careful about that, I guess, over the last year, 2 years. I definitely have my vegan ice cream binges, Miyoko's butter. And just to be clear, this is just an anecdote. It's not proof of anything. It's not proof that a vegan diet is healthy. It's not proof that a vegan diet is unhealthy. It's just my own personal blood work. A lot of this is heavily influenced by genetic factors as well, but also it's not super surprising that my lipid panel is good, right? That is not just genetics. I don't eat cheese and meat and milk. It's not that surprising. But also, I know there are vegans who have talked about yo, I eat a vegan diet and my cholesterol is still not great, right? So definitely genetics play a role, and some people have to be a little more careful. Some people naturally have higher triglycerides, and maybe they need to be careful about the amount of refined carbs they consume. And that is something that I was not concerned, but interesting to see what my triglycerides would look like, because I eat my sweets. I'm not super careful about limiting my sugar, if I'm being honest. I really should for my teeth, since I've had so many teeth issues in the past. But you know what? Since I've been, you won't believe this, brushing consistently, flossing every single day. I think I've missed 2 days in the last year. Going to the dentist every 6 months for the past several years. Guess what? No cavities, nothing. My teeth are great. Shocking. I'm just trying to defend my sugar consumption because I love candy. I love fruit snacks, which are also candy. I can easily maintain a healthy weight eating a lot of candy. My blood works fine. My teeth are fine. There's no incentive for me to eat less sugar. Oh, they did check my weight too, which is normal BMI 22 or 23, something like that. And they also took my blood pressure, which is normal, but honestly a little higher than it normally is. Mine is always a little bit higher in the doctor's office. They actually call it white coat hypertension, but I mean, it's not hypertension levels, but yeah, mine's always a little bit higher. Whenever I check it at home, almost consistently, it's 110/70. I try so hard every time too. I had the consultation just yesterday and they did blood pressure again. And I was like, okay. And it was 125/85 or something. What? It's such a stressful test. Anyway, thank you so much for watching, guys. I really hope you enjoyed this. I would love to know your thoughts. And again, you know, not proof of anything, just a fun little anecdote I thought maybe you guys would enjoy. Please do like and subscribe, hit the bell, all that great stuff that helps out the channel. And of course, thank you so much to my members here on YouTube and all of my patrons at patreon.com/unnaturalvegan. Running out of air a little bit there. And I do post 2 exclusive videos a month for tier 2 members and patrons. I do a vlog, and then I do a controversial, just talking about whatever I want to talk about. Last month's March was about Blake Lively, all of that stuff. I just had to get that off my chest. It was driving me crazy. Yeah, thanks again, guys. New video soon.